Hello everyone, my name is Maria Carlisle. I'm an advanced practice nurse educator at Toronto Rehab, which is part of University Health Network in Toronto, Ontario. Along with me today will be Gabriela Goleas, the Director of Practice for Toronto Rehab. Welcome to our poster presentation titled Translating Change at the Point of Care, the Development of a Person-Centered Emergency Response Training for Nurses. Historically, patients admitted to Toronto Rehab were quite stable that required limited interventions. However, with the onset of the pandemic, it has forced our rehab hospitals to flex and adapt to accepting more patients who are COVID recovered along with other acute illnesses. Understanding that the pandemic has changed our patient populations, it was evident that nurses and interprofessional teams needed to have a refresher on fundamentals of care, such as attending to a code blue response or medical emergency. The acuity of patients coming to rehab facilities continues to challenge us, and as such, we need to ensure that staff are equipped with tools and resources to respond appropriately and timely. The goals and objectives of the day included entry-level basic fundamentals with regards to code blue response, interprofessional approach for all team members, including our physicians, and bite-sized education presented at stations facilitated by the educators like myself. Implementation, the practice committee discussed a plan to create a fun day for staff to practice their skills and to learn any new practices or updates. In quotations, Garrison et al. 2021 states that utilizing technology in games and teaching involves the adult learner, stimulates mental engagement, thereby contributing to learning, retention, and immediate feedback rather than delivering content to the learner, end of quotations. This two-day education includes games and activities to enhance learning and retention. At each station, the facilitator gave a high-level overview of key points relevant for learning. Staff were given a passport where they had opportunities to answer some checkpoint questions while also applying their knowledge and skills. The interactive games helped them understand medications and roles and responsibilities of code blue response. Medication activity, which is behind me over here, which spin the wheel, name that drug, and identify what code response would they administer the medication. Roles and responsibilities game, which is up here, match up cartoon characters along with corresponding responsibilities. We also had a reflection board. Staff used heart-shaped post-it notes to jot down what they learned from attending this code blue education. A CPR playlist also was playing in the background to add more fun to the day while they toured the various stations. In concluding our poster presentation, 100 staff had attended the two-day session. Staff feedback was that it was a fun way to learn. It improved team dynamics, understand roles and responsibilities. We are currently utilizing some of the games in our new hire orientation with some positive feedback. Our plan is to hold these education sessions biannually, and the next one will be in October. This concludes our presentation, and we thank you for listening in. Ray and Gabby.